If you're watching this video, it means you've booked the time to speak to me directly, Colm, the owner of Dental Appointments, about possibly working with us or just finding out a bit more about what it is that we do. We've recently sent you an email about our 10 patient test drive offer where we'll send you 10 patients in 30 days and perhaps it's piqued your interest. And so in this video, I'm going to walk you through how it all works. But before we go any further, let's address the elephant in the room. At this point, you might be thinking, Colm, it all sounds great, but I want to see what kind of results you can get me before I make any kind of commitment. Or you might be also thinking, Colm, this all sounds fantastic, but of course you're going to say it's great, but how do I really know that this system is going to work for me? And I want you to know that I hear you and I agree with you. That's why we do things a little differently. Most agencies won't put their money where their mouth is, and most marketing agencies also won't offer you a test drive. But that's not us. We're just a bit different. We're actually so confident in our system that we're happy to put 10 patients into your clinic and then you decide if working with us is a good business decision. Why should you listen to me? What have I done to warrant your attention? Well, we've worked with dentists using this framework for about 7 years now, and we've got some really good results. So I'm going to just walk you through a couple. The first one here is Dr. Peter Doherty. Peter, like many dentists, has worked with a marketing agency in the past before us. He's ran Facebook ads and he got mediocre to poor results. He started working with us, and over a short-ish period of time, we got him some great results, also using Facebook ads. Now Peter's generating about 22 all-on-4 patients per month. He's happy, we're happy. Peter's kindly given us a testimonial, which is on this page, so you're welcome to have a look and find out a bit more about Peter's experience yourself. The next dentist we have here is Dr. Niall Vallely. Niall, like Peter, has worked with a marketing agency, and like Peter, he's got mediocre results running Facebook ads. We worked with Niall and his team quite closely over a period of time. Happy to say we're still working with both Peter and Niall, and we're getting some great results. Currently, Niall is getting about 28 bonding patients a month. So Niall's a cosmetic dentist, and Niall has also kindly given us a testimonial, which is also on this page. Do check that one out as well. Finally, we have Dr. Paul O'Connell here. Paul specializes in orthodontics. Paul came to us looking for more Spark Aligner patients. It's a similar treatment to Invisalign. Yeah, Paul is now seeing about 16 Spark Aligner patients per month. So very positive indeed. And yeah, grateful to be working with such great dentists. Just before we go any further, there is a couple of things that I want to walk you through that make us a little bit different than perhaps other marketing agencies you may have dealt with in the past. And the first thing is that we consider ourselves to be a non-equity partner. So what do I mean by that? So even though we haven't actually invested in your clinic, we act like we do. So we take responsibility for the success of your clinic, the profitability of your clinic, and the revenue that you're generating. So we're not concerned with lead count, with appointments, with patients. Really the only thing that we're concerned with is the amount of money that you put into your marketing and the amount of money that you get out. Because ultimately, I think you'll agree that's the most important thing. A lot of other marketing agencies, they just talk about leads and appointments, where we're focused on the success of your business. Because when you become successful, that helps us to become successful also. So the next thing that makes us a little bit different is our automated patient schedule system. And the reason I mention this here is a lot of other marketing agencies, they really don't do this. They talk about leads, but what we do is we actually book your inquiries directly into your diary, qualify them, we deliver them to you, and you just need to show up and provide the treatment. What we don't do is we don't just use AI to do this. We don't just call them or we don't just text them. We literally do everything. So we have a team in place to call them. We call your inquiries straight away. We also text them. We call them again to remind them 24 hours before the appointment. So yeah, so you can rest assured we will deliver those appointments to you. And whenever someone starts working with us, we take all the information, all the relevant information, and we make it seem as if we're a part of your team. So we're an extension of your clinic and we're both a part of your team. The next thing that makes us a bit different is highly personalized videos. So we've worked with dentists, and maybe you can relate to this also, who have worked with 2, 3, 4 different marketing agencies and haven't seen any success. And then often they come to us and we work with them and we have some crazy success. I mean, just like Peter Doherty we spoke about earlier, generating 22 all-on-4 patients per month. So the question you have is, where's the difference? What makes you guys so different when it comes to Facebook ads? So what we do is we use highly personalized videos from the clinic and we put them out to the marketplace. we solve problems, we speak directly to your audience, we generate inquiries, and we just make it work just like that. Okay, so really the alternative to that is just putting the same advertising out there as every other clinic. And if you're going to do the same as everybody else, you're going to get very average results. And I'm sure you're not interested in being average. We're definitely not. So the highly personalized videos is something that we feel quite strongly about. We've seen some really good results, and we have a strong framework that we hope to work with you on. And hopefully you can see results like Peter someday soon. The next thing that makes us a bit different is how we qualify your appointments. So often we hear from clinics say, Colm, yes, Facebook ads drives inquiries, but those inquiries are often of very, very poor quality. And again, we hear you, we understand you, but we do things a little bit differently. So if we're going to work together, we get you onboarded, we get the offer in place, we get everything set up, and then we run your advertising. Then what we do is we speak on a weekly basis, and you give us feedback on the quality of the appointments that we're sending to you. And based on that feedback, there's a number of levers we can pull to further qualify those appointments. So for example, we can ask more qualifying questions in the ad. If we want to disqualify certain people, we can ask more qualification questions on the phone. Also, what we can do is we can send people more educational content in advance of their appointment, just to make sure they're fully informed on the cost, on the offer, on the payment plans, on the expected results, on the time frame, just to make sure that when we deliver these people to you, they're fully qualified, they're ready to go, and they're looking forward to working with you and receiving treatment. So I'm just going to talk about now who this program is not for. So unfortunately, we can't work with every dental clinic, and there's a couple of character traits that we see from dental clinics who are the most successful that we work with. These traits are as follows. So dental clinics that understand that marketing takes time. So consider the fact that we're dealing with thousands of people, we're dealing with the public, we're dealing with different geographies, and there's a lot of moving parts. Marketing does take time. It's very much a test and measure approach. We get feedback. We're very much partners with your clinic, and we're inching forward to hitting that sweet spot and really making it work for you. So the dentists in our experience that understand that, work with us, implement our recommendations. Those dentists are the dentists that actually, unsurprisingly, see the results that they want to see. So the second thing is trusting us. So in the same way that if I was to walk into your dental surgery and give you advice on how to give me a dental implant, I think we both know that wouldn't go well. And in the same way, you giving us advice on how to market your clinic probably wouldn't go well either. Otherwise, you would be doing it yourself. So we do require a level of trust. Hopefully, that's pretty self-explanatory. And then the final thing is the highly personalized video. So if you're not in a position to shoot some videos couple of times a month, two or three times a month, we're probably not for you. It's crucial that you shoot the videos, you send them over to us in a timely manner. Otherwise, it's just not going to work. And we've looked at results with these videos, and we looked at the results without them, and really it's day and night. And if you're serious about growing your clinic, then we only really want to work with those clinics who take on board our advice and are willing to shoot videos and send them to us for their advertising. So that's a bit of a picture of the business and the system, and hopefully some of this, at least some of it, has resonated with you. But the cherry on top is this is all included in the test drive. And when we have our call, which is hopefully very soon, if you're a good fit for us and we're a good fit for you, we will invite you to test drive the system. Now, there is a cost to the system. It's just a couple of £100 or dollars, depending on where you are. It's just to cover our costs, just to make sure we don't go out of business. But we'll walk you through this on our call. So, guys, that's it for this video. I really appreciate you watching the whole lot, and I look forward to speaking to you very soon.